Hello, I'm Dr. Marc, a geriatrician and an expert in dementia and Alzheimer's disease. I'm asked all the time, what is this new Medicare guide model that I'm hearing about that supports people living with dementia and their caregivers at home? It's a great question. I'll try to answer it in under 5 minutes. Medicare has always paid for things like hospitalizations and rehabilitation after discharge, and hospice and visits to their doctors, etc. But for the first time, the Medicare guide model is providing comprehensive wraparound services for families who are dealing with Alzheimer's and dementia and living at home along the entire journey. The Medicare guide model provides families who are dealing with dementia at home a dedicated care navigator, usually a nurse or a social worker, 24/7 access to those people, as well as monthly check-ins, a personalized care plan so we can think about how to anticipate the needs tomorrow, not just dealing with what we have to deal with today, advice from experts on things like transitional care, where one can live in the community based on one's needs, how to help make sure that any caregivers who come into the home are of very high quality, and ultimately what to do near the end of life when other decisions have to be made, and potentially that respite benefit of up to about $2,500 a year for respite services. How does one find out if one is eligible for the guide model? This is a great question too. First, one must have a diagnosis of some kind of dementia. That might sound simple, but many people with memory loss struggle to get an accurate diagnosis, and so we can help with that if need be, but one has to have a diagnosis of one of the many dementias out there: Alzheimer's disease, Lewy body dementia, frontotemporal dementia, vascular dementia, Parkinson's, all of those are included. Second, one has to have Medicare Part A and Part B. That's called traditional Medicare in my parlance. Things like Medicare Advantage are not included in the guide model today. One cannot currently be in hospice and be in guide at the same time. One cannot be living permanently as a resident in a nursing home. One can be in a nursing home for rehab, but you have to be discharged back to the community to be in guide. And if you're dually eligible for both Medicare and Medicaid, you can be in the guide model unless you are part of what's called a Special Needs Program, SNP. How do you find out if you're eligible? One can go directly to LizzyCare.com and find an eligibility check. Very, very simple 5-minute screen that'll give you a pretty good sense of whether you're eligible for guide or not, or just call the number and they'll take you through the questionnaire. Actual enrollment into guide usually takes less than a week, occasionally takes 2 or 3 weeks, and upon enrollment, that's when we find out from Medicare whether you're eligible for that respite payment, those dollars that you can spend on respite for your caregivers at home. The program is really designed to help people live fruitful, meaningful lives at home safely with dementia, but also to help the caregivers and families who are doing so much of the work at home feel more confident in the decisions they're making, feel empowered to do the right things, and also feel like they have a team of experts that they can call anytime they need to navigate along the journey. We've enrolled many patients into the program so far. We find it to be incredibly successful and meaningful, being there alongside families who are wondering if they're making the right decisions at home. Now we really feel paired with them, and we know what's happening in the home on a regular basis, and they can reach out anytime for assistance. So check out the Medicare guide model, and I hope this has been helpful in explaining it a little bit. Thanks again for watching, and I'll see you next time.